All right. So what are the moments you feel sad and depressed, and what helps during those times? We're going to come back to that, and we're going to talk a lot tonight about what I think is really a spectrum. The spectrum from the normal changes in mood that we all go through, the normal day-to-day ups and downs that are just part of being human, to depression that seems to have a more seasonal bite to it. So if when we notice in the winter we tend to really feel blah, and how to differentiate between normal seasonal blah and then how to look at more serious clinical depression. You may already be familiar with a lot of that information, but there are interventions that we offer at Bastyr that Dr. Culver will talk about and I will talk about for the whole spectrum of what is happening. First, I want to share a couple of quotes with you from Parker J. Palmer. He was interviewed by The Sun magazine in November of 2012. Parker J. Palmer is a writer and academic. He also lived for many, many years in what was sort of basically a Quaker commune. And he wrote really candidly in this interview in The Sun about his own episodes of clinical depression that he had reoccurring throughout his life. And the first quote that I want to share with you is this: "Depression is a great mystery. I've talked with a number of experts, and they all say that there's much we don't know about it. There is some psychiatric consensus that many people are able to work through depression over time. Yes, it's hard, but you come out of it, or it comes out of you eventually. But if you're afraid of yourself, you're likely to prolong that recovery. And you may even find yourself moving towards greater darkness." So, hopefully, you already have some information about yourself and what your normal moods are. So, how do you tell if it's changing to something else? And how do we make sure we're not misinterpreting what is a normal seasonal downturn? This is a bear. I love bears, in part because bears, at least bears in the wild, have that wonderful connection to natural rhythm, and they don't try to argue with it a whole lot, right? So in the spring, bears emerge, they eat, they take care of their young, they roam around, and then during the summer and the fall, what are bears doing? Those of you who know about bears. Yeah, they're getting ready to hibernate, right? So they're eating, they're storing up fat, and they're getting ready to hibernate. And a female bear, I particularly like this statistic, will gain and lose about 2/3 of her body weight every year. And what bears know, just intuitively, in ways that I think sometimes we've lost our natural connection with, is that there is a seasonality to our bodies and to our rhythms and to our energy. And even though we live now in these very natural environments, and we prolong our waking hours with artificial light, with caffeine, with stimulants, we have work schedules that are unchanged, we have kids that need taking care of, really from an evolutionary standpoint, there is a natural slowdown in the winter. So we'll be talking about clinical depression and what's involved in that, but we'll also talk about how to be gentler and kinder to ourselves and support ourselves a little bit more when we have that slowdown, when we feel more tired, when we're craving carbs. There's actually evolutionary reasons why we would do that. So if you were to come into our office and say, "I think I'm depressed," I would ask you to talk about what that means for you. And first of all, we know that depression is a very serious problem, resulting in everything from more money lost in work days to sort of ancillary or secondary conditions such as substance abuse and addiction, suicidality or suicide attempts, and just in general sort of the adult version of failure to thrive, although of course depression shows up in kids and teenagers too. So I would ask you, just for the range of your experiences, to find out what you might be experiencing that would make me want to know sort of where to go. And some of the symptoms that you might talk about would be a depressed mood, decreased interest or pleasure. In other words, things that used to give you joy don't anymore. And there's a question on your handout about joy. Any sort of change in your eating, your sleeping, or your energy level. Some people will stop eating and sleep all the time. Some people will eat way more and not be able to sleep at all. So changes in your regular signs we will look for and try to find out how long has that been going on for you. Some of the more worrisome things that jump out at us are at the bottom. If you start feeling hopeless, if there are feelings that come up of your own worthlessness, if you start thinking about dying or death a lot, even if it's missing loved ones, unless there's been a recent death in the family, if that goes on more often than not, more hours of the day than not, for most of the days in 2 weeks, then what we start looking at is where we want to intervene and where we want to help you, okay? What's interesting to me when I read that is that 2 weeks is a really short amount of time. So the other thing that we're not necessarily interested in doing is overdiagnosing depression and rushing to diagnose depression when what it is normal ups and downs and moods. So a lot of what we'll be talking about is how comfortable are we with our own emotional spectrum? Have we been here before? Have we had this sort of feeling before? And what has been helpful in moving out of it? And so as you look at your own paper and you look at what you wrote down as far as what was helpful with that, different things work at different times for different people. And as Parker J. Palmer said, for some reason you seem to come out of it or it comes out of you. And there is some mystery as to why that might be. Diagnosing, if that's what we're going to do. And remember, at Bastyr, we're interested in you as a whole person. We're not just interested in the part of your life that isn't going well. We're interested in all of you. But what we'll also be curious about is that your depression may not necessarily feel like what traditional depression is. You may just notice that you're kind of flat. One person described it to me as the color just sort of went out of the world. It was hard to get out of bed, but I wasn't really that sad. So for any reason, I think, it's helpful just to have a good idea of what your regular moods are, to know when you've taken a dip if you have. The holiday season can be hard. How many of you might agree with that statement? All right. All kinds of reasons why it might be hard. What are some of the reasons, if you don't mind sharing, that the holidays are hard for you, those of you who said it was? Anybody want to volunteer a reason?
Up there, right there.
It's right up there?
No, this lady up there.
Oh, oh, thanks. Oh, okay. Did I miss somebody? Sorry, I walked right by you. Yeah.
Oh, that's okay.
Yeah.
Well, I have a little trouble with my spouse.
Okay.
He absolutely abhors Christmas.
Oh, okay.
So I'm inside of me fighting for my right to enjoy Christmas.
Okay.
And it's almost impossible.
Okay. So you really love it, spouse doesn't. Really hard for you to enjoy it. Okay. Okay. People have all kinds of mixed feelings about the holidays. Yeah, thank you. Anybody else have thoughts? Please.
Well, holidays tend to be, presented to us artificially in terms of entertainment and commercial. And
Right.
They're not always a sleigh ride out to Grandma's house and snow.
Right. So there's a lot of hype and they come with a lot of expectations. And when we have really, really high expectations, almost always it's going to fall short, right? And for many of us, that can be difficult and that can be alienating.
Resolve if you have dysfunctional families or relationships.
Right.
They just continue, just their disguise kind of thing.
Right. 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 So if there's dysfunctionality around the family, it might be a little better in the holidays, but then it's going to go right back to what it was before. Yeah. Totally. Yes. Yes. Anybody else? Please.
Food. I have issues with food, and so oftentimes the holidays it's really hard for me to. I either overindulge or I will restrict myself a lot.
Right. Right. Because there's so much emphasis on holiday food, right? So there's an onslaught of sugar and alcohol and wheat and chocolate and all these great things. And what's interesting is, biologically, again, the bad news is we are programmed to crave carbohydrates. Well, for some of us, that's bad news. Carbohydrates can help be the building blocks of tryptophan or serotonin in the brain. So a lot of times if our serotonin levels drop down, we will be craving foods that will help replenish those stores. But at the same time, there's a lot of food out there during the holidays. Yeah, so that can be tricky. So for all those reasons, and having idealized expectations of what we believe or what we've been told, the holidays should be this way. Any of you hear that should voice in your head? Okay. So helpful tip number one, when you hear your own head saying, well, I should do this way, I want you to ask yourself two questions. Number one, who's saying that? Who says I should? Should is sort of an external voice. Psychologically, when we hear should, we believe that it's some externalized voice from the past that we may or may not agree with. We may agree with it. So when that voice says, well, I should want to go to 4 parties, and I should make homemade cookies, and I should do all these things, okay? It can be really helpful to sit still, take a deep breath, ground yourself, and ask a simple but very powerful question. What is best for me right now? What is best for me right now? Do I want to go to the holiday party? Or do I want to get some sleep? Or do I want to call a friend instead? So when you notice those shoulds becoming louder, just sit gently with them and say, what is best for me right now? That can be one really helpful way. There is significant financial stress placed on us during the holidays, especially those of you that are providers and parents, especially those of you who are unemployed or underemployed. There's a lot of meaning-making stress placed on you. And by that I mean, if, you mentioned before, family relationships and dysfunctionality, if we are lonely, if we feel isolated already, the holidays can really accentuate that and make it feel even worse, right? So the expectations are very high. And inevitably, if there's an idealized expectation that we don't meet, even though we feel like we should, we can be very, very sad. We can feel very depressed, okay? And we're not talking about clinical depression necessarily. We're talking about more of the holiday blues, a little bit of the bah humbug sort of syndrome. So how do we get to a place where, for the holiday season and beyond, okay, not just for this season, we can have an experience of finding meaning without completely exhausting ourselves? Physically, emotionally, energetically, financially, okay? How do we come through the holiday season trying to pay attention to what is best for us right now, gently sitting with our shoulds and letting them go, and not dragging ourselves to exhaustion? So one thing that we'll look at, seasonal depression, there really do seem to be symptoms. We are far north of the equator, and one thing we know about Seattle is that it has a greater cluster of MS prevalence here, and a greater cluster of seasonal affective disorder, or SAD, as it's appropriately named. Now, the causality of that, I think Dr. Culver is going to talk about that. Hours of sunlight, exposure to vitamin D, all of those things are very important. We'll talk about that later when we get to treatment. The question on your handout that I want you to consider and think about is the next one, and that is, who or what brings you joy? Who or what brings you joy? Right now, in this moment, right now. Boy. I don't, but we can make more copies by the end of the night. Extra ones with these.
For all of them.
Just this one.
Yeah,
Thank you.
perfect. Thanks. For some of you, it might have been easy and quick to write down who or what brings you joy. For some of you, it might have been harder. When I ask clients to do this, we look a lot at focusing on gratitude and gratitude journaling. This is not meant to be a panacea or a bit of pablum. It's not where you ignore all the pain in your life and you put a smile on and you say, okay, I'm gonna look on the bright side and find joy. That's not what this is about. Affirmations don't work if there's unresolved stuff in your life that needs to be taken care of and if you need support. But it is about shifting our focus to, what, if anything, in my life is going good right now? And if joy is too strong of a word, then I ask people to look at what doesn't hurt, what feels pretty good, what gives you some relief, where are your moments of peace? Once we start attending to them and taking notice of them, if we're forced to write down at least one a day, we'll shift our focus a little bit. The mind, the body, and the spirit work together, so a lot of what we're going to talk about is all linked. So, is it in your mind? Yes. Is it in your spirit and your emotions and your energy? Sure. Doesn't matter. They're all connected together. Parker J. Palmer had this to say about his own depression. He thought it was purely a spiritual exercise, and at one point he had depression that was severe enough that he was fairly house-ridden and bedridden for a number of months at a time. So he really went through it. And what he said was this: depression felt to me like what St. John of the Cross called a dark night of the soul. There were spiritual lessons to be learned, but only after I had come through it. When you're in it, there's no such thing as God or spirit. You're in a void, hopeless. But as you start to emerge, you can retrieve lessons from the darkness, such as gratitudes for small glints of light. So we're looking for glints of light in all of our lives. We're looking for that. I'm not suggesting to you that if you come in to the clinic and tell us that you feel sad or depressed, we're going to then say, well, that's a meaningful experience, and go forth and find meaning. Everybody metabolizes it differently, but I think there can be meaning in our experiences as long as we have support moving through them. Woo. So physically, as a psychologist who's trained existentially, I'm trained to look a lot at meaning making and choices in people's lives and to help them make more satisfying choices for themselves. So one of the first things that I would suggest is that you do take very, very good care of your body. And if you notice a change in your mood or in your energy that we've been talking about, that you consult with a primary care physician right away. Some medical conditions can actually come across like depression, such as underactive thyroids, some heart conditions, etc. So it's good to get checked out and make sure that your physical health is what you expect it to be. It's also helpful to be aware that if you're on medications for depression or for mood stabilization, that if something feels like it's not working, that you consult really carefully before you lower the dose or increase the dose or go off altogether. Because doing that abruptly can have interesting effects on your body, including anxiety attacks and worse, depression. So if you're going to do that, for sure talk to your prescriber. It sounds really clear, but during the holiday season, there's lots of alcohol around us. Alcohol is a depressant. So if you tend toward feeling bluer, especially in the winter months, decrease your alcohol. And just notice what happens after you have some and see how it affects you. That's usually the best way to sort of experiment with that. It could be, as Parker J. Palmer found out long after his depression, that there is some sort of spiritual work that is being done in the throes of that depression, that it's not purposeless. But that's yours to decide. It's not for your provider to look at you and say, I want you to find the meaning behind your sorrow. One of the things that we look at is, on a scale of 1 to 10, 1 being depression is so severe that getting out of bed is a significant effort, and there are some days that I won't do it, to 10 being I have no symptoms, life is great, I'm at Bastyr mostly just for fun, right? So usually a 4 or under, we're going to be more aggressive, if I can use that word, in our treatment approach with you. We're going to be more active in helping you until those numbers come up enough where you can really take over a lot of your own self-care. Oftentimes the trap we fall into is that cognitively we know what to do, right? We sleep, we get exercise, we get social support, we play with our pets, we do all of those things. We know what to do. But when you're in the throes of really severe depression, how likely are you to do any of those things for yourself? Not usually very. So we'll try to aim our interventions at where you actually are. In other words, it's not as though each and every one of us is going to have the exact same depression. You're going to have very different experiences of it. And so we have to find what your particular experience is and work with you from that place. Remember, if we are stuck in the past with regret, if we are catastrophizing out to the future, saying it's never going to get any better, it's never going to change, we miss the only thing we have, which is the present right now. And a lot of the counseling work that we do and that I work with the students on doing is very present focused. There is tremendous power in the phrase right now, especially when you're depressed. Right now, I feel sad. Why? What does right now do versus I feel sad? What happens if you add right now? Does anybody notice anything? Say that again?
It makes it more temporary.
It makes it more temporary. Even if we don't believe it and it doesn't feel like it, it inserts the possibility that I feel this way right now, it doesn't mean I will forever. Yeah, thank you. There's a lot of power in the phrase right now. I'm going to skip over the cortisol section. We talked a little bit about how adrenal fatigue and cortisol fatigue and serotonin lack can lead to waking up and feeling really, really depressed. And I think Dr. Culver's going to cover that as well. And this we've talked about a lot. I want to look at these, the middle 2 pieces here, actually the middle 3 pieces here. How do we feel about if we have an increased need for sleep, an increased need for carbs, and even though there's a lot of pressure on us to go, go, go and be social and be active and be busy, we really don't want to? How good are we at giving ourselves permission to just have the energy that we have naturally? Not very good, a lot of us, or sometimes it's really hard, right? Those shoulds come into play, right? Do we overextend ourselves to make other folks happy? Yeah. And when we do that, we can feel pretty depleted pretty quickly, pretty fatigued pretty quickly. And again, I go back to the 2 main questions. What is best for me right now? And who am I doing this for, right? Who am I doing this for? And plenty of times the answer might be, I'm doing it for somebody else and I'll feel better. But we have to include our own needs in there, or we will be emotionally exhausted and depleted, even if we're not already depressed. Holiday seasons, again, oftentimes sort of highlight how we feel about our connections to our work, how we feel about our connections to our loved ones and our relationships, and anything in there that's not going particularly well. We feel it more keenly during that time. And are we having the holiday season, since we're talking about the holidays, that's really in accordance with our values? What do we want out of the holiday season? And can we include our own needs in there? These are hard questions. We could probably spend the whole night talking about them. Oh, and I did want to talk about the happiness trap. We have some stigma around feelings of sadness, or telling others that you feel sad, or telling others that you don't really like the holidays, or telling others that you don't want to go out and go to the party, right? Is anybody familiar with what I'm talking about when I say the happiness trap?
Yeah.
Yeah, what is it? What is that?
Well, people expect you to be happy
Right,
at certain times, especially during the holidays.
exactly, right.
They think you're crazy if you say you don't like it, or you would rather stay home and not go anywhere.
Right, exactly, yes, thank you. And we ourselves believe a little bit, and we've been trained to believe by a lot of media and a lot of other active agencies that we should be happy all the time. And if we're not happy all the time, something is wrong with us, and we should do something about it, right? There's something deficient in our lives. Well, of course, the reality is nobody's happy all the time. There's normal ups and downs, okay? But we can really, really beat ourselves up quite a bit and shame ourselves a bit if we're saying, something's wrong with me, I should be happy and I'm just not. Instead of simply mindfully sitting with, how do I feel right now? Right now, I'm tired and I don't want to go to the party. Right now, I'd rather sleep a little bit more. Right now, I feel pretty good and I'll go out and I'll call my friends. There's a lot of power in just sitting still and asking ourselves right now how we feel. This is a question that our own Leanna Standish begins most of her patient visits with, so I'm told, and I love it. How is your spirit? How is your spirit? Isn't that lovely? It's so much different than stick out your tongue and let's get a blood sample. How is your spirit? And where is your spirit and where is your voice in the midst of all of the holiday hustle bustle? What we know for sure, regardless of what religious or spiritual faith or spiritual beliefs that any of us have, isolation from others and isolation from something more meaningful or bigger than ourselves is associated with really poor health outcomes. It's associated with suppressed immune function, more physical illness, more chronic stress, cortisol elevation, adrenal depletion, poorer sleep, and depression. So, getting in touch with what gives you joy, getting in touch with who or what has meaning in your life, what is there out there that is bigger than you and stronger than you that you can look to, especially when things are rough, is really crucially important all the time, especially if you're in the midst of one of those dark nights of the soul. Biological treatment, you've got the information, and I know Dr. Culver's going to talk a great deal about that. So I'll close with psychological treatment. One of the first things that I would point out is, come see us for counseling at the Bastyr Center for Natural Health. We've recently changed our prices, and so visits are $20. It's a bargain. It's great. We'll give you the most excellent attention that we can. By the way, counseling, like any other modality, is not just when things are going poorly. It's really good to come in proactively and have relationships in place so that if something does hit a rocky point for you, you've already got resources. It's easier to go. It's really hard to reach out and ask for help if you're feeling sad or if you have clinical depression, right? It's really hard to come up with that energy. Sleep, hygiene, and exercise are physical modalities that do huge amounts for depression. Study after study after study that compared typical SSRI antidepressants taken appropriately with exercise alone or exercise and cognitive behavioral therapy, which one had the stronger effects? Moderate exercise and moderate exercise with talk therapy combined had about the same effects. They had a statistically more significant effect longitudinally over at least a year on depression than SSRIs with fewer negative side effects. At the same time, what I would say is that's not true for everyone, and I would never stand here and say if SSRIs are helpful for you with your depressive symptoms that you should go off of them. No, I don't think people should suffer needlessly. Your depression will be different. But it's possible in some cases that moderate exercise can be really, really helpful. Some of the other things that we would talk about in a counseling session, expressive arts, the gratitude journal that I mentioned before, realistic expectations for oneself, self-compassion, and having really, really good, compassionate, loving boundaries with others, including saying, no, I don't want to go to the party, or I'd rather stay home, or instead of spending a lot of money on a gift, I'd like us to do something else. Okay? And I think, okay. So this last slide and the last question, that what I would have for you, and the invitation I would make, how often do you have access to who or what brings you joy? You wrote down a bit about what brings you joy. What I'm going to invite you is to focus a little bit more time on doing those things, or talking to those people, being around people who uplift you rather than make you feel drained, being around people who are reciprocal and that you can have fun with and who listen to you when you have needs. Really, really important. Right now, I'm doing the best I can. For today, I feel such and such. Okay, that's my portion. I'll turn it over to Dr. Culver, and we'll take questions at the end. Thank you. Okay.
Just give us a moment for the technical thing.
The technicality, yeah. Do you want the clicker?
That would be great.
Sure. And you get the microphone. Good job. The microphone assistance. Oh, thank you.
Just make sure it's on.
Over time, sorry about that.
No worries.
Like everyone's happy, so it's fine. No one's complaining.
You've had time to have your tea?
Yes.
Unfortunately, the... All right. Okay, so if you can put this in your pocket, if you have one. If not, we can do the clip. The clip is like really... There you go. Perfect. Now if you can go as high, kind of like right up to here. There you go. Just make sure it's I'm just going to do this for you if that's okay.
Please.
Okay, that should be good.
Okay.
So welcome everyone. Again, thank you for coming tonight. It's a pleasure to be able to give you some information that's just a good underlying foundation for you to understand depression and also to understand what tools are available to you through our clinic here. As I mentioned, I'm a resident upstairs, so I work with the team care and I have a private practice where I practice naturopathic primary care medicine. And today we're going to continue talking about depression. I'm going to kind of segue from more of the mental emotional side of things that Dr. Davis was talking about and look at the physical components that we can contribute to. She really oriented us to the broader spectrum of the human being as being not just a physical body or an emotional body, but a physical, emotional, mental, spiritual body. So all of those things are intertwined. To try to separate them and just treat one in a piecemeal fashion really does you a disservice, because we can support another system by fostering one side of things, and also we may not be aware that there's physical components to our depression. So today I want to focus on the keys to happiness, which who doesn't want those? And it's not a big secret. It's the keys to everything in life. It's what we call the determinants of health. It's things that just are foundational to being a healthy, happy human being. We have diet, exercise, our exposure to sunlight, as well as our sleep patterns. So I'm going to start with diet. Kind of a loaded term. Oh, also, dogs are cute. That's what brings me joy, so I brought them to you. Diet, we have Atkins diet, Mediterranean diet, standard American diet, high fat, low carb, low carb. You pick it, you name it. It's out there. You can have it. What I mean by diet is simply what you're eating. So how can we address what you're eating in a simple, understandable way to where you're not trying to follow a bunch of garbled instructions that's going to support your overall health. We can get a little bit more specific to depression by focusing on blood sugar regulation, because as I'll talk about, our ability to have an even blood sugar level is going to really help our brain work optimally, as well as the rest of our body. And last, we can look at food intolerances, which maybe some of you have seen gluten-free food out there. That's an intolerance that's pretty popular, but there's a number of things that our body can react to and not have the best outcome. So a whole food diet. Well, this didn't transfer as well as I would like. Whole food diet. This is the basics. This is what every person can start with and feel like they have a good grasp on what food is. Eat food that looks like food, that looks like what it's called. If it's an apple, it should look like an apple, not a sauce that has sugar and preservatives added to it, not in a fruit leather form, again, that has sugar and preservatives added to it, just an apple. And the reason I say that is because we're really thinking about what nutrients we're putting into our body. Are we getting enough of them? Are we getting the iron, the micronutrients like B12 that our body needs to actually be fueled? Because what we eat gets delivered out into all of our tissue space, into every cell. We also need to really think about what toxins we're taking in. By toxins, that doesn't mean nuclear waste in our food, because hopefully in America we're not exposed to that. But there are things like exogenous hormones from meat. If you're eating meat that has hormones pumped through it day in and day out through its life, when you eat that meat, you're in turn getting those hormones into your body. There's also preservatives, food dyes, and I can't say it enough, sugar. Sugar is in everything we eat. If you ever take a look at that nutrition label, look at how many grams of sugar you're eating. I was just working with a patient the other day who is on a gluten-free diet, because gluten-free is the new healthy fad. And I myself am gluten-free, and I believe that there are times when that is necessary, but why give up gluten if you're not intolerant to it? Another topic for another day on that one. Anyway, so she's eating these gluten-free foods thinking it's going to be really healthy for her. This patient's a diabetic. She brings in her bag so we can see of the food that she's eating. The bread she's eating has 26 grams of sugar per slice. That is a lot of sugar for bread, for something that's supposed to be whole grain and healthy for her. Then she's eating granola bars that have another 26 grams of sugar in them because they're gluten-free, and that's what she thinks is healthy. So one, look at your food labels, look at what you're eating, really think about those macronutrients. By macronutrients, I mean carbohydrates or sugars, fiber, protein, and fat. And just think about how much you're eating. If you have more questions or want to go into more details with this, that's a very individualized conversation. But in general, too much sugar is not good, especially simple sugars. Fiber is great because it bulks us up. It helps us feel full when we have those carb cravings. That can be really helpful. But as I'm going to talk about after this, protein is something that can really help us in life. A lot of us don't eat enough protein. Okay, kind of went off topic there, sorry. Gluten always gets me riled up. So, whole foods. The reason why we're focused on them is because the apple has nutrients in it. It has fiber. It's low sugar. Eating it, you're going to feel good. It's going to do things for your body. And it doesn't have the extra toxins that are going to bog you down. Now, these toxins that we're talking about, they're still being researched. We're still trying to understand all the ways that they can affect us and all the ways that we get them into our body. But what they can affect is not only how we feel. They can give us fatigue. Some people have headaches. They can cause a depressed mood. They can alter your mood because your body is having to now fight something that you're constantly putting into it. So the goal, as this is the government's, the FDA's new food pyramid. Instead of a pyramid, now we have a plate, because that, who eats a pyramid? The main thing that almost every naturopath is going to agree on is this part right here where half of your plate is fruits or vegetables. I would say 99% of us don't eat enough fruits or vegetables. If you think about 6 to 7 portions a day, that is a lot of vegetables. I don't know how many of us do that. I have to work at it and be like, kale for breakfast again, huh? Ugh, one more day. But there are healthy ways to do that. Eating half your plate full of vegetables, you're going to get fiber, you're going to help get the nutrients you need, and you're going to avoid eating extra toxins. So step 1, clean diet, eat foods that look like they are, and eat a lot of fruits and vegetables. So the next thing we're going to go into is the additional step of maybe tracking the protein that you're eating. So who here likes Starbucks? Anybody? Yeah, I know there's more of you out there. We all love that sugary, caffeinated beverage on a cloudy day. It's the afternoon. I have another 6 hours of work to go to. Yes, that sounds delicious. But the problem with that is it's very short-lived. You're going to have something that gives you maybe 30 minutes of energy. Honestly, with that much sugar, what happens is your blood sugar goes way up. You feel awesome. 5 to 30 minutes, and then because your body has pumped out insulin from your pancreas, all that blood sugar goes away and you drop down like a brick into hypoglycemia. Nobody likes hypoglycemia, and we have all felt it, that the zombie face. When you see people walking around with zombie face, it's because they just had sugar and now they're crashed and they don't know what to do with themselves. Because we have so much sugar intake, our bodies are kind of on this huge up and down. We get out of control, and our brains aren't getting fed what they need to be fed. So I don't think everybody understands what the brain actually eats. It's not everything that we eat, it's just sugar. That's the main thing that our brain feeds off of. And if you have a steady stream of it, the brain is happy because it's constantly getting exactly what it needs. If you have this peak and trough system from eating donuts in the morning and then a granola bar for a snack that has 26 grams of sugar in it, and then who knows what up from there, you're going to have a brain that feels like it's on crack, where you're going to have super good highs, and then you're going to go through withdrawals every time you don't eat that sugary bar. That feels a lot like depression to some people. And in people with diabetes, there's a high incidence of depression, which is why we want to work preventatively, proactively, and as healthy people, we can work to prevent these problems from happening by regulating our blood sugar, keeping it more level. Instead of causing peaks and troughs, when you eat protein, what happens is your blood sugar slowly rises, and then it's going to stay at that level for 3 to 4 hours before it slowly declines. So you're not going to have zombie face. What you're going to have is feeling a lot better. You're going to be more in control of your cravings for food. So if you have a problem with needing that Starbucks or needing that candy bar, having protein on board is going to help you feel like you're in control of your diet. And as the talk is about, we're going to feel better in our mental, emotional health. So again, protein every 3 to 4 hours. To give you an idea of protein, a handful of nuts, a few slices of turkey or cheese, seeds and beans. Those are great sources of protein that you can include in your diet and in your snacks. If we really need to get serious on this, then we can start talking about cutting out food groups and looking for things that your body is not reacting positively to. The classic example, the gluten example, is celiac disease. Celiac disease is a very serious condition that has an increased incidence of cancer if you're not treating it right. So it's something that does need to be monitored by a doctor. You do need to be on a gluten-free diet. And the reason I say that, there's evidence even related to depression. 1/3 of people with celiac disease have been found to have depression in their lifetime. However, if they adhere to the diet where they're not eating what they're allergic to, which is gluten, the protein gliadin, they have drastically decreased levels of depression. This is a pretty serious condition, but it's an example that we can use to illuminate smaller conditions. What if we're mildly irritated by dairy? And that mild irritation builds up in our system, and eventually we're getting manifestations of that irritation, which as a doctor we call symptoms. You can have anything: headaches, gut irritation, diarrhea, constipation, and you can have mood disorders from it. If we've done all the other stuff, your diet is looking great, you're eating whole foods, you're eating fruits and vegetables, you're eating protein regularly, you're not eating sugar, then we can go in and start doing some testing to find out if there's any food sensitivities there that are present that you don't know about. So we can do this through your diet, through eliminating foods and then re-challenging them to see if you have a reaction to it. Or there's some blood tests that certain doctors like to work with that look at antibodies in your gut and whether they're present to different food groups. Oh, it's not going to work. I had a picture of dogs running in the ocean, and it was really awesome. So imagine my awesome dog and, yeah, running around in the ocean. Okay, it's amazing. We're all there. So these dogs look happy, don't they? Okay, they look great. Not everyone, the first time you exercise, is going to feel better. But as Dr. Davis talks about, the research out there for exercise is ad nauseum. It goes on forever. Exercise is one of the best things you can do for yourself if you're feeling low. It's one of the best things you can do for yourself as a human being. Exercise is built into our genes. It's what we need to do to be healthy. That doesn't mean you need to be an Ironman. It doesn't mean you need to run 6 hours a day. It means you need to move every day. And the best thing would be if you sweat every day, as my friend Asaf says. So with that, some people get really gung-ho and they go out and they run 3 miles and then they are burnt out for the next 6 days because they've torn a hammy or something like that. It's better to walk 15 minutes every single day than it is to walk 1 hour once a week. It's best if you can just try to be consistent with it. There's gonna be challenges that you face, and that's why it's great to get someone on your team, like a naturopath or your primary care provider, to be a source of motivation, a source of accountability that makes sure that you're still doing it, and someone who can give you guidance and new ideas, because if you're not liking what you're doing for exercise, you're not gonna keep doing it. If you do the exercise, it's gonna help your mood. That's established, but it's gonna have some other benefits. Most people report that they have increased energy from exercising. If you exercise and you feel worse afterwards, you need to talk to your doctor, because that can indicate that you have anemia or significant fatigue. So just keep that in mind. Generally, you do feel better. You feel like you have more energy, you're more awake. Part of that is because you're getting a bunch of endorphins dumped into your system, which is why you feel happy. If you get that system going to where you're producing endorphins every day, you're gonna feel a lot happier in general. Blood sugar regulation, this goes back to the protein intake, but it's also going to benefit you in terms of preventing diabetes, or if you have diabetes, exercise helps to increase your insulin sensitivity. So it's going to help your body respond better to your own blood sugar regulation system. The last thing is, if you find something that you love doing, there's always community of people out there who like doing it too. You like trail running, there's a whole group of people trail running. You like hiking, there's groups on meetup.com for hiking every weekend. Do you like swimming or water polo or whatever you like doing? I swear there's a group in Seattle for it. So make friends, get out there, build those connections that help you stay afloat when you hit tough times. Sunlight. It is hard living in Seattle in the winter. Getting up to be here at 8 in the morning, meaning I have to leave my house by 7 when the sun is still down, that kills me. I'm from Colorado where it's sunny all the time, all winter long. The reason this takes an effect on us, I'll talk about, there's 2 main hormones in our body that sunlight actually works to regulate. And because we live in this high latitude, longitude, we have to kind of buffer ourselves, and we have to take advantage of the sun we get. We can talk about how we can fake having sunlight from a natural standpoint, and how if you have things like seasonal affective disorder, there's a lot of research about how we can improve our symptoms during winter months. So as I said, there's a couple ways that sunlight affects us. And the first is that vitamin D. So the MS incidence and the seasonal affective disorder prevalence in the Northwest is believed to be related to vitamin D. And the reason vitamin D comes up is because when sunlight hits our skin, it's a part of a reaction that takes vitamin D from an inactive form to a more active form, so that our liver and our kidneys can turn it into the hormone that helps regulate our bone mass and our energy and affects pretty much every cell in our body. Unfortunately, living in Seattle, for almost 9 months of the year, the sun hits the atmosphere at such an angle to where it doesn't actually facilitate that conversion. I was recently talking to a supervisor on another shift who said that a lot of insurance companies will no longer pay for vitamin D levels because pretty much everyone has low vitamin D in the area, and it's better just to preventatively treat as though you have low vitamin D. Yes? Did you?
They have to check to make sure it's come up.
It's good for tracking treatment goals, that's true. But in terms of screening, most people end up being put on a vitamin D, especially in winter months. In terms of dosing, individualized, you need to talk to a doctor about that. I can't give you a standardized dose. The other thing they found is that sunlight, just being in sunlight, makes us happy because it seems to somehow activate our serotonin. Serotonin is the happy hormone in our body. We're not sure if it's through the skin, we're not sure if it's because of the wavelength in our eye, so that's still kind of out there, but at this point it's safe to presume that just being in sunlight, even if we're not getting the vitamin D, may be actually activating our happy hormone pathway. So when there's sun outside, go outside, especially during the winter. Take 15 minutes. It's worth going out and walking, breathing some fresh air. You can get that 15-minute walk in, get some sunlight, and you're going to feel a little better. During summer, you do need to use sunscreen when you're out for longer periods of time, but 15 minutes in the sun is not going to lead to any deleterious effects later. So just be mindful of that. We can supplement with vitamin D3 to help support that, which has been found to really work effectively in seasonal affective disorder. And that would be a different dose than just preventative dosing. And the last thing are those happy lights. Has anyone seen happy lights? Costco has a special on them sometimes. So if you have depression during winter months, those have been found to be very effective. The key is that you have to use them 30 minutes a day, and it's best if you do it when you wake up. That is a pretty big time commitment, and a lot of people aren't able to follow through all the way on 30 minutes every single day, but even a little bit can be helpful. And they actually have versions of these lights that will be your alarm clock. So if you do have a hard time like me getting up when it's really dark outside, it lights up your room and it makes it so your circadian rhythm gets a little more on track. And we're going to talk a little bit more about the circadian rhythm with sleep. So the circadian rhythm is our cycle of waking and sleeping. It's our body's hormonal connection to when it's light and dark out. And when we have depression, what tends to happen is there's a breakdown in that connection. We need to learn how to reinstate that cycle. And part of what we do with that is what Dr. Davis alluded to, the sleep hygiene. So hygiene, just how can we make this as optimized as possible? For a lot of people, what this means is there's going to be some needing to adjust your sleep schedule. Going to bed at the same time every night and getting up at the same time every morning, including on weekends, is one of the best things you can do for yourself in terms of keeping your circadian rhythm going through these times where our days get shorter and shorter and shorter. If you have problems falling asleep or staying asleep, that can be related to depression. It can also be something different than that, and there are a lot of tools that we have as naturopaths to be able to help you facilitate good, healthy sleep. The other thing to consider with sleep is what's going on around you. Does your partner snore really loud? Is that keeping you awake? Are there cars honking their horns on the street? Is the street light coming in and hitting you in the eye all night long? It's really good to think about the environment that you create for yourself. A lot of research has gone into showing that we really like dark places. We like quiet places or places with very low consistent sounds. So if you do have loud neighbors, a white noise machine can be a really helpful addition, or a fan going. And the temperature is also very important. We tend to like cooler temperatures when we're sleeping than we do when we're awake. So don't keep your house heated too hot at night. It's also going to save you money on those hefty winter bills. With all of these things, there are so many ways that we can support you. All of these changes take a lot of work on your part, but it doesn't have to be a total uphill battle. That's why we have things like our education. We, as naturopaths, are taught that our first role is teacher. We're here to help you understand your body better so that you can make the decisions that are going to support you for your health, because I can't do the work for you. You have to want to do it. We have botanicals that can help, herbs that can support you in sleep, in mood, in anxiety, and all the adjunctive things that come along with depression. Homeopathy is a type of medicine that fits your whole person picture. So your physical symptoms, your mental, emotional symptoms, and to some extent even your personality and your spiritual symptoms. What that means is that if you are in that dark spiritual conundrum that was talked about by Dr. Davis, homeopathy can be really just a helpful nudge to move you out of the most difficult places. We also have nutraceuticals. Everybody's heard of D3 or B12, melatonin, 5-HTP. We have a whole bunch of nutrients that we can help to foster proper physiologic response to our environment. I practice a lot of medicine that's hands-on, like manipulation, deep tissue massage. I work with a lot of physical complaints. There's different modalities that are specifically good for stress, like craniosacral therapy is what I practice. And craniosacral therapy is a way of gentle hands-on therapy that helps induce the parasympathetic state, which is basically, it helps you relax. It helps you unwind. It helps you with physical things on a physical level, but it also is fostering a deep peace. So we have that upstairs. As was mentioned, counseling appointments are $20. That is a ridiculously low price. So take advantage. It's a very good deal. We have very competent students, and we have great supervisors that are all here to help people find their peace and find what motivates them to be happy, healthy, and holy. So we're going to open up the floor to questions now.